have, in an easy way, we're always shy to talk about it. Perhaps it's been stigmatized. So I'm really excited that Lab2Doctors, of course, we have a founder here, Dr. Chessie, uh, is bringing this conversation to the limelight. Today, be prepared for an insightful session. We're going to talk about why STD test results are emotionally charged, and we're going to discuss the common misconceptions that we can have or everybody has about positive and negatives. And also, do you even know that globally it is seen and recognized that 1 in every 25 people has at least one of the four major curable sexually transmitted infections? But unfortunately, a lot of these cases are asymptomatic. So people can have infections and not even be aware that they have these infections. So many of these cases, they go untreated, they go undiagnosed, and this is the major reason why Lab2Doctors is here to talk about these cases. Of course, with me today, I have a trailblazer in the industry. This woman is a woman after my own heart. And I'm always excited to introduce Dr. Chessie. Dr. Chessie, it's so good to have you. Dr. Chessie is the founder of Lab2Doctors. She has decades of experience with the lab medical field, and we're really glad to have you join us today. Hello, Dr. Chessie. It's good to have you on the call.
Hi, Olayemi, and hello, everyone. Thank you for making time out of your busy schedules to join us today, to join us in this session that we'll be talking about lab testing in sexually transmitted diseases. Let me go ahead and share my slides.
Okay. So I enjoin you to have beside you a pen, a paper, and whatever questions you might have before Dr. Chessie begins her presentation. So as you're listening, you can jot down the questions that you might have to ask Dr. Chessie for our special question and answer segment. Thank you. So over to you, Dr. Chessie.
I'm coming. Sometimes this technology, you think you're so ready, and then you're not ready.
I just if so, it's fine. It's coming.
Yeah, okay, so let's see. Presentation mode. Let's see, escape. Okay, let's go. Instead of the last slide, we'll begin with the first slide.
Okay.
Okay. So let me know if you see in presentation mode at this time. Can everybody see in present? Okay, great. Welcome again, and thank you for joining us today at this time during the season when there's a lot more time on our hands and we can be so free and find ourselves contracting communicable diseases that we do not even know how to go about it. That's the reason why, as the founder and the chief vision officer of Lab2Doctors, I selected this topic for the season. So it's going to be I'll be talking about the truth between the lines, what STD test results can and can't tell us about infidelity. So this is not, you must not have been a victim of infidelity. In general, STD testing. Either you've had to do some STD testing or you know someone who has had to do it. So it's not about infidelity per se, but when it comes to the aspect of infidelity, when you do not know what it takes to get the right results, it can actually break up relationships, kill others, and just make the community toxic just because of wrong lab results. Not because the lab went wrong, but because the person who is the patient did not know how to go about it. So there are 3 rights. There's something I call the 3 rights for STD test preparation. These 3 rights are the things that, as a patient, as a clinician who is ordering STD test, you should know if you need quality lab results. The first being the right time. You're going to hear me talk about the infection window. That infection window is the right time. Is the right time when it's good to detect and have a true positive STD test result when you go to the lab. Not only the right time, The second R is the right test. There are a lot of tests in the lab, and all these tests have different characteristics. When it comes to STD, we target biological indicators of disease. And these biological indicators of disease could be an antigen, it could be an antibody, it could be metabolites of the disease, it could be cell fragments of the pathogen that has infected you. So you realize that there are different things. We could come from a different angle to design a test that picks it up that will be able to identify the disease. It's just like taking a picture. You could take a picture from the left, the right, from the back. At the end of the day, you're taking a picture of that one object. So that's the way it looks like. But that doesn't mean that you'll be seeing the same picture every time. If you take a picture from my back, expect to see my back. You cannot want to see my face, and you're taking a picture from my back. That's the same way lab testing is. So it's very important that you select the right test. And the last right, when it comes to lab testing for STD, is the right infection. So make sure that you're ordering as a clinician, even as a patient, because there are retail test kits for sexually transmitted disease testing. As a patient, you could just walk into a drugstore and order one test for yourself. You want to check to see if you're HIV positive. You want to see if you have syphilis, whatever it is. As a clinician, you could also be ordering this test for your patients. Just be sure that you're ordering the right test for the right sample at the right time. These are the 3 R's that I consider important when it comes to getting the right result out of any lab. So there's a responsibility you have as a patient to make this happen. There's a responsibility you have as a clinician to make this happen. So consider this road with loops, twists, and turns to be the sexually transmitted disease that is in your body. So that is the disease. And like I told you before, in the lab, with lab testing, we target, there are different biological indicators that we target to identify, to correctly and accurately identify a disease, that you are infected and the disease is present during the phase of that disease that was tested. So it could be antigens, it could be antibodies, it could be DNA material, RNA, it could be metabolites, like I told you, it could be DNA. For example, if you're infected with HIV, we design tests that would identify the genetic material from HIV, be it HIV-1 or HIV-2. It could be proteins. And again, as you realize, there are different colors and different shapes of these proteins that are on the screen. You see some yellow, some purple, some green. These proteins come in different shapes. They have different characteristics. They have different functions. So implying that that's the reason why we have so many different tests for the same infectious agent. There are so many different tests for HIV. There are so many different tests for syphilis. There are so many different tests for herpes simplex virus. And you go on and on. Some of the shapes could even be this. You realize that every time I click, there's a new shape that pops up. This tells you why it's important. The right time, the right test, and the right infection. If you want to get, you need to get all 3 right to be right. So when infection, when you are infected, the clinician orders therapy that would target that infection. And if you get the right therapy, you'd be on your way to healing. You are not going to find that winding road that I showed you before with twists and turns. When you are on your way to healing, you realize that it's no longer twist. You will no longer see the many loops, twists, and turns. So let's say, for example, the therapy was supposed to target the blue protein. If you use the right test, you'll be able to identify all blue proteins. Just take note as these colors disappear on the screen. If the test was supposed to target the green proteins, all the green proteins disappear. It means that the test identified it correctly. If the test was supposed to identify any other proteins, now the purple proteins. So you need to have the 3 R's to get the right results. The yellow proteins and then the red proteins. And when you've identified everything, you realize that the road is no longer with so many loops or not so many twists and turns. You're on your way to healing, and because you've been able to identify, the test identified the right microorganisms, and the therapy has been targeted against the right microorganisms. So you would be on your way to healing. What if the wrong things were targeted? What if all the wrong things happened? What if you didn't use the 3 R's? So today, for this discussion, that was just an intro. For this discussion, we'll be talking about, we cannot use some 45 minutes to talk about all the pathogens or sexually transmitted diseases that exist. For this discussion, we'll be talking about the herpes simplex virus, HIV, syphilis, chlamydia, and gonorrhea. It's not going to be like a lecture format. What we do on this platform is to mimic the typical questions that clinicians and patients have been asking us. And then we bring it to a webinar so that you can hear for yourself what the right answers are. And then you know who to turn to, who to go to when that time comes.
Okay. Okay, thank you, Dr. Chelsea. So let's head straight into it. Now we're talking on herpes simplex virus, HSF. So would you say that this is a true positive, or could it be a false alarm from cross-reactivity?
So when it comes to herpes simplex virus, there are a lot of cross-reactivity issues. You have viruses that share approximately the same structure as the herpes virus. And this can, because of, I just showed you different proteins and different colors. So when you have two different viruses that have approximately different structures, and that the area of the test that was targeted is similar between two different viruses, there's the possibility for cross-reactivity. That means that you are not only infected with herpes simplex virus, or you may not only be infected by it, you may be infected by another virus that has a structure similar to that of herpes simplex virus. For example, the varicella zoster virus and the Epstein-Barr virus. There are also antibodies for hepatitis, for the herpes simplex virus 1. The antibodies for herpes simplex virus 1 sometimes would trigger a positive result if you are infected with herpes simplex virus 2, and vice versa. So remember, there are two different strains of the herpes simplex virus. We have the 1 and the 2. So somehow the antibody test could trigger a positive for identifying the wrong strain of the herpes simplex virus you're interested in knowing.
Thank you so much for that, Professor Chelsea. So moving on to my next question now is, can the test tell when I was infected or who I got it from? This is the herpes simplex virus. Can it tell?
So the herpes simplex virus, it detects the presence of the virus. For the testing, the swab, a swab sample is provided to the lab. The swab sample normally comes from a sore from the outbreak of the herpes simplex virus. So they use a swab in cleaning up the sore, and that swab is given to the lab. Herpes simplex virus does not detect the timing of infection, nor the identity of the individual who is infected. You're muted.
So in other words, the herpes simplex virus detects the presence of the virus from a swab sample, right?
That's correct.
That means it can't exactly detect the timing of the infection or the identity of the infection.
So can you say that again, please? That it cannot detect? Yes, it cannot detect the timing of the infection.
Okay.
Yes.
Okay,
Yeah.
that's great clarification. So now let's speak about the symptoms. Some people have symptoms, but they go for testing and the test comes back negative. What can we say happens in that situation?
So yeah, and when it comes to sexually transmitted disease testing, especially because we are always targeting an antibody and antigen most of the times, it's possible to have false negative results. So depending on the So this is where I told you one of my R's was timing, right? The timing and the infection. You need to get the timing and the infection right. So
Yes.
if the testing is done too soon, too soon after you are exposed to the infection, you've not developed enough antibodies. Because of that, you could have false negative results. Also, if the test was designed to identify IgG antibodies, normally IgM antibodies are the antibodies that show up first in the case of infection. But if you selected a test, let's say you went over the counter, you went to the drugstore and picked up a test to see if you're infected with herpes, and this test is an IgG test. IgG tests may not detect the virus itself, and they are usually less reliable. When it comes to herpes simplex, IgG tests are less reliable. Sometimes also the virus hides because the sample is collected in a swab and is put in normal saline. Sometimes the virus would be left in the normal saline instead of having it in the sample in the test kit where the testing is supposed to be performed. So in this case, this is not because of the patient, nor the clinician, but now this is a testing technique. So if this was a point of care testing where you got it from over the counter, I would say it's the patient's fault. But if it was done within the lab, then this is a fault from the technique of the technician performing the test. So the timing and the test is very important to avoid
So,
false negative results.
okay, so we're just speaking about timing and getting the reliable and the adequate results. So, how soon after one is exposed can these tests actually detect the infection accurately?
So a lot of research has been done. A lot of research has been done when it comes to timing.
Yeah.
If you say how soon, I would say that with respect to a test that is, I don't know who is writing on the screen. With respect to a test that detects IgM, it would tell you how recent, if you were recently infected and you have a positive result, then it means that it's a recent infection.
Okay.
If it's an infection that you've had long ago and you select a test that is an IgG test, then it shows past exposure to the herpes simplex virus. So that is exactly what the test does. And so if you contest your results and you think you want it redone or you just doubt the results, it's always important to consult an expert, a laboratory medicine expert or your clinician. Just make sure you're consulting someone who knows. When I say consult, I'm not even talking about AI, because the information on AI is put there by people like you and me. And it's
Yes.
not as current as I am talking today. So if somebody put something there yesterday and there was a recent research that has changed the content, the quality of the content, you may be missing out because you are relying on AI and not real humans. AI will not replace human totally, not when it comes to
Absolutely.
identifying and avoiding false results.
You're very right, Dr. Chelsea. So if we're speaking about this test results, right, what does an equivocal or low positive result mean? And if someone has pre-adventure a low positive, does that mean that the person needs to do a retest?
We really don't have we rather have equivocal.
Okay.
Equivocal pretty much means that you are in the gray zone of the test. The gray zone is you're somewhere between more positive and negative. The test is not able to say that you're negative, it's not able to say you're positive because there's not enough of the infectious agent that is being measured to make that claim, right? In this case, sometimes we are going to retest that sample using another method, a more sensitive method. There are different lab tests, and some are more sensitive than others.
Okay.
So that all of that counts.
Hmm. Okay. Thank you, Dr. Chelsea. I think this is well explanatory. And I just want to mention to the people listening out there, to you listening out there, if you have any questions, please don't hesitate to drop your questions in the chat box. All will be attended to before the end of this session is over. So now we can move on to the next slide, which is HIV. Now, speaking about HIV, Dr. Chelsea, how accurate is the results you get from this? And especially if one tests soon after exposure, how would you say accurate the result can be?
So the accuracy when it comes to HIV is something so close to my heart, not because I have it, not because I have family members who have it, because I don't know anyone who has it, but it's really close to my heart because it has greatly affected the next generation. Yeah. The next generation of leaders in this world are, for some reason, maybe due to their social behaviors, not observing the right protection measures, have been greatly affected by HIV. Yes. So when it comes to the accuracy of this test, it depends on which test you get. Okay? Is it a rapid test for HIV? Is it being tested in a lab on a platform? And how recently were you exposed to HIV? How your body responds to the new HIV infection. For example, have you developed antibodies already? Or how soon after exposure were you tested? These are all the things that I would like for you to consider if you want to question the accuracy of your results for HIV testing. Do not just go out there that I have a kit or I have a rapid test and I need to know if I have HIV. Everything I just mentioned are the things you should consider if you're really worried about having the right results.
Thank you, Dr. Chelsea. So you mentioned a rapid test and a lab-based test. So can you tell us the difference between a rapid test and a lab-based test?
Okay, so the rapid tests give you results within a very short time, right? Okay. But meanwhile, when you go into the lab, because of all the accuracy and quality checks that have been put in place, these tests have some different protocols that we follow to test your sample. For the rapid test typically picks let's see, with the rapid test, it picks up the antibodies that have been indicated against the HIV infection. So if you are infected with HIV and you pick up a rapid test, you'll be able to get results because the rapid tests are designed for either HIV antibodies or HIV antigens. But we also have the combo rapid test, which means that it detects both the HIV antigen and antibodies. So irrespective of when you are doing the test, if you decide that you want to increase your chances of eliminating false results or false negative results or false positive results, look for an HIV combo test. It's combo because it identifies antigens and antibodies. So irrespective of the phase of infection where you are, if you select an HIV combo test, be sure that you'll be able to have results that reflect your stage of infection, if indeed you're actually infected. There are also lab-based antigen antibody tests. But the lab-based antigen antibody tests have a shorter window period within which it detects the HIV virus. For the lab-based HIV, the combo test, it detects within 18 to 45 days after exposure to the HIV virus. Meanwhile, for the rapid test, it has a window period that can be as long as 90 days. So if you go for a rapid test, the window period of detection is longer. If you go for a lab-based test, the window period is from infection day 18 to infection day 45. And then we also have the nucleic acid test. Nucleic acid test is the only test that detects the actual virus in a sample of your blood. When you get results from a nucleic acid test, it tells you about the viral load. That's why we say it's the only test that tells you about the actual virus in your blood, because it gives you the viral load. It has the shortest window period. It detects transmission as early as 10 days after infection. Wow. So if you just need to know the type of test you're looking for, and no, just probably approximate your window period. When do you think you were exposed, so that you're not wasting your money, wasting your time, and even causing havoc to your emotions? Because if you get positive results that are false, you can be in trouble. You may get mad at people, and that is not healthy either.
Exactly. So I would like for you to also say from your own experience, right? What would you say is going to be the best to use from a rapid test and a lab-based? And which of these are the ones that are going to give you the most accurate result?
Okay, so in my opinion, as a laboratory director, as
Unfortunately.
someone who's been in the lab medicine field for 15 plus years, I would tell you to go for a nucleic acid test.
Okay.
I understand that the window for testing is 10 days only. But if you cannot have a nucleic acid test done, I would tell you to go into a lab and have your sample collected, and to be able to do the test that has the 18 to 45 days after exposure.
Okay.
Usually, I try to stay away from the rapid test because the technique of the person performing that test matters a lot. If it says mix, if it says twist, if it says spin, if it says leave it at this temperature, and you do not, you're already compromising the quality of the results.
Okay. So this means that it's not a test that you should carry out by yourself in order to get the accurate result, right?
Correct. You can try. Maybe you're saving time, you're saving money because you don't want to pay the lab, but you also risk hurting your emotions if you get false positive or false negative results. If you get false negative results, you may go out there infecting other people, right? But if you get false positive results, nobody knows. Some people get so emotional that they may actually end up hurting themselves. You don't want to hurt yourself over a wrong result. Why not go to the experts? That's
Exactly.
really the advice I give.
Okay, thank you, Dr. Chessie. So moving forward, could medications or other conditions also affect the result?
Okay, there's something we call pre-exposure prophylaxis.
Okay.
Pre-exposure prophylaxis, which are antiretroviral drugs that suppresses the virus in the blood. These drugs make it difficult to detect the presence of disease with a standard HIV test. So there are so many people who are infected with HIV and they are on pre-exposure prophylaxis. If you are one of those people, know that this is the issue when it comes to being on pre-exposure prophylaxis and testing to see if you are still infected. This can lead to false negative results. It indicates that a person does not have HIV when they actually do have HIV. It's just because of the drug they're taking. The best option would be probably you do a test that identifies the P24 antigen of HIV, which tells you exactly that this antigen is present. Even though you can use it, even at it will be detected even at low levels.
Hmm. Okay. Thank you, Dr. Chessie, for that. Before we move on to the next slide, I would just like to talk to everyone listening, to you listening. Do not forget to drop your questions, and wherever you're joining us from, we also would love to know. So please drop your name and tell us where you're joining us from. Join in the conversation and reserve your questions. We're going to have the question and answer segment. It's been such an enlightening session with Dr. Chessie here today, and we're discussing, of course, are false STD lab results actually false? And this is for people that are just
Okay, I think she lost. This is when technology fails us. So we are discussing if
PR.
false. Okay,
Can you hear me?
now we can hear you.
Okay, so why is my RPR VDR test reactive, but I have no symptoms?
So when it comes to the RPR and the VDRL, these are non-treponemal tests. So implying that they are not actually detecting they are not strictly for syphilis only. Why do I say so? If you are infected with syphilis, you have antibodies from other things that can be picked up by the non-treponemal test, that is the RPR test. There are low levels of antibodies that remain active even after you are treated for syphilis. So you can have false positive results as well. There are other sources of false positive results when it comes to the RPR test for syphilis. Take note, I'm saying RPR because there's the treponemal and the non-treponemal. So this is the treponemal test for syphilis. You could have false positive because you have low antibodies that remain long after you've been treated for the syphilis infection. Autoimmune diseases like Lyme disease and certain viral infections, even injection drug use, would also cause false positive results when you use the non-treponemal test. There are also algorithms that we use within the lab to perform syphilis testing. Some labs use it the reverse way, and others use it the right way. Depending on the lab you're using, sometimes it's good for you to know, because the test algorithm used by a lab may cause false positive results for you. The algorithm we use is an algorithm that was approved by FDA. So I know there are some labs that sometimes it's cost effective to use it the reverse way. It could be cost effective, but then not cost effective for the lab, but not cost effective for the patient, because the false positive would cause you to spend more money trying to find out if you're actually positive. So if you have a latent syphilis infection, a reactive stage, that is, if you have a latent syphilis infection, a reactive test could be evaluated and treated. So, meaning that you've been sick, let's say that you were sick long ago and, it's just there. It's dormant, but it's there, If you test and it says that it's reactive, sometimes it's good to actually confirm that you've not been reinfected, or that it's just a pre-existing particle of the previous infection that is still in your system, not that you are actively infected. You're muted.
I would like for you to also tell the people who are not healthcare savvy now, in that sense, the full meaning of that RPR and VDR test.
Well, I would tell you that as much as I'm going to tell you the meaning, I'll tell you that if you go to a lab, nobody will tell you the meaning. I'm giving you the lab language, okay? If you go say, I want rapid plasma reagent, everybody's going to look at you like, what are they talking about? Because that is not lab language. For the purpose of this webinar, for the purpose of what Lab2Doctors wants to do, we want to speak to the community. We want to pick up even that person who is not interested in healthcare to know the right language to use to enable you get the right results. For that reason, RPR means rapid plasma reagent. Again, I do not think it's anything anybody would ask you. Just say, I want the RPR test, or I don't want it. It's non-treponemal. To me, that's what you should really be talking about. The non-treponemal test or the treponemal test.
Okay. So now moving on to our next question. Could this also be a false positive from pregnancy, autoimmune disease or another infection?
Yes, like I said earlier, the RPR test, because it's non-treponemal, when you're pregnant, there's a lot of changes that go on in your body. You produce antibodies that cross-react with the test. So we've had situations where pregnant women test positive for syphilis when they are not even pregnant. So that's why if you're pregnant and you're going for this test, tell them I want a treponemal test and not a non-treponemal test. Also, we have when you have autoimmune diseases like lupus, rheumatoid arthritis, it can cause false positive results due to antibodies that look like the antibodies that are targeted against syphilis. So again, be aware of this cross-reactivity, be aware of your system. So when you go to the lab, you ask them that, do you have the non-treponemal test? To be on the safe side, maybe just ask for a treponemal test. So you're not dealing with all these questions and answers.
Okay, thank you for that, Dr. Chessy. So what would you say is the difference between screening and confirmatory tests, and which one of these matters the most?
A screening test indicates the presence or indicates a present or a past infection, and it is non-specific.
Okay.
Usually for the screening test, we use the RPR test. So the RPR, I told you that is non-treponemal. For the screening test, that's what we use. And you realize I just said it's non-specific. Why? Because of all these other cross-reacting possibilities. But that's what we use for screening for syphilis. Confirmatory test, like it says confirmatory, it confirms the presence of disease. And I would tell you also that we do not do confirmatory tests with non-treponemal tests. We use treponemal tests to do confirmatory tests because it's specific to the treponemal antigens or the proteins from the treponemal pathogen. So you're either confirming or you're not confirming. You're screening or you're confirming. But you need to know if you're going for screening, what you're doing, what you're using. Indirectly, you're saying that I want the non-treponemal test. So usually the screening test is also cheaper compared to the confirmatory test.
Okay. Okay. Wow. But why is it cheaper though?
Why is it cheaper?
Yeah.
Because it's going to be some rapid test, some platform that does not have, when it comes to the confirmatory test, we have reagents and we have a lot of different reagents. There's a platform that is done on it. For the screening, sometimes all you need is just a microscope. You take that sample, put under the microscope, do a drop of reagent, and you're done. And you look at it and say it's positive or not, right?
And the result
So you
is
see how
accurate.
easy it is? Sorry?
Yeah, it's easy. It's easy, right? But is the result accurate?
It's accurate for the purpose of the test. If you say you want screening, for screening test, it is accurate.
Okay. Okay. Glad we have that sorted. Okay, so let's move on to syphilis dormancy now. Can syphilis be dormant and still show up on a test?
Yes, I think latent syphilis can test positive. It means you've had the disease for a long time, it's just in your body. So it's asymptomatic. For some reason, maybe your system is mounting a fight. Your antibodies are mounting a fight and you're taking vitamins, you're eating the right things. It doesn't, all of these things will not stop the infection. The infection is there. You're just empowering your body to mount a fight against the infection, right? So it's going to be there for a long time, and we call it latent because it's asymptomatic. It's asymptomatic because you're eating right, your vitamins, you're exercising, but you are infected. It's not going to stop that infection. And the infection is active when it's undetectable. When it's undetectable, the infection can still be active, right? But again, when it's latent, when it's dormant, it may just be because your body is able to mount an immune fight. And also for latent syphilis, it can remain active for decades. And if untreated, it can damage your organs. So just remember that you may be eating the right thing, doing exercise, and but if that syphilis is in there, it's also causing havoc by the time you realize it.
Thank you so much, Dr. Jesse. So let's discuss about the test accuracy, right? How soon after exposure to syphilis can the test detect the infection?
So again, the accuracy of the test depends on, I just told you about treponemal and non-treponemal. Yeah. So when it comes to the non-treponemal test, the RPR or the VDRL, you can detect a positive result within 3 to 6 weeks after potential exposure. And this is not specific to Treponema pallidum, the pathogen that causes syphilis, right? But when it comes to the treponemal test, within 1 to 2 weeks, you can detect it, but it can take 2 to 12 weeks, depending on other individual factors like your immune response. I made mention of eating right, taking vitamins, exercising. So if you have if you've mounted an immune response, it may take a while before the disease shows up. So again, with the treponemal test, which is more specific, 1 to 2 weeks, but depending on your system, it may take 2 to 12 weeks.
Okay, thank you so much, Dr. Chessie. Because our time is running out, I think we can move on to the next slide, which is chlamydia and gonorrhea. So speaking on this now, the first question we have here is, why did my urine test come back negative even though I have symptoms?
So the timing of the test, I told you about my 3 hours. Timing,
Yeah.
timing, timing. Timing is everything when it comes to STD testing. So the timing of the test, both chlamydia and gonorrhea can take 1 to 3 months to show up in a test. 1 to 3 months to show up in a test. Just take note of this period because you may test earlier than that and feel like, oh, I'm not infected. Just be aware of that timing. The quality of the sample collected as well. If you are urinating within 2 hours of sample collection, it can alter the results.
Wow.
So you just need to follow the instructions given to you when the urine sample has to be collected. Every lab has a direction. I cannot give you the direction as if it's one size fits all. There are conditions in that lab that would make them tell you to collect it in 5 minutes, in 10 minutes, or whenever. But just take note that the quality of the sample matters. So you need to follow the instructions given. Also, the sensitivity of the test. A low sensitivity test may miss detecting the infection. A urine test could miss something a swab test wouldn't pick up. So if the swab is collected and you have a high concentration of the pathogen on the swab could pick it up. But what if the swab was poorly collected? If the urine sample is properly collected, even when it's low, the quantity of the pathogen is low, if the test sensitivity is good enough, what is a good sensitive test? A good sensitive test is that which can detect minute levels of infection. And sometimes, not even sometimes, but every time, as a patient, as a clinician, how often have you sat and said, called the lab and said, I need to do a chlamydia test. Is your test sensitive? Or what is the sensitivity of your test? This is not a typical question that we hear in the lab. But I want to empower all of you. I want to educate everyone here to know what to be asking the lab when you reach out to a lab, to know what to ask Lab2Doctors when you reach out to us. Thank you.
Okay, thank you so much, Dr. Chessie. Let's move on to our next question. Does one need a throat or rectal swab if one has had oral or anal sex?
So I would say yes. You need this. You need the right sample if you have to get tested. Extragenital testing is essential for accurate diagnosis, especially in asymptomatic patients. So we need the right sample if you need the right results. Yeah.
Okay, thank you for that, Dr. Chessie. The next question is, can one also transmit the infection even while having no symptoms? For example, as we discussed before, there are so many cases that go unnoticed because they figure out there are no symptoms showing. So that means that perhaps I cannot transmit the infection. But do you think or would you say that it is possible to transmit this infection even when you have no symptoms?
Yes, and that's part of the reason why I decided to put chlamydia and gonorrhea together, because they have similar risk factors and they are often asymptomatic. You can transmit chlamydia and gonorrhea if you have no symptoms. So do not rely on symptoms.
So it's important that one gets tested, but how often would you say one should get a general, test, especially when you are sexually active?
Being sexually active doesn't mean that it depends on your social interactions. If you know that you are hanging out with the wrong people, with infected people, that's when you should be worried. Just being sexually active doesn't mean anything to me, right? Because it means that we are saying that everybody above the age of 15 should go just randomly get tested. But no, I would say that you know yourself, you know the people you hang out with, you know your behaviors. And if you know that you are involved in the wrong behavior that could expose you to these diseases, then I would say that you may want to get tested every month.
Okay, so for people that are being intimate with one another, they have to get tested every month, right?
No,
you are
it's not,
advising?
no, not being intimate. It's who are you intimate with? Are
Okay.
you intimate with the right people? It doesn't mean everybody who is sexually active is infected, right? So the
Right.
question is, are you intimate with a drug addict? Are you intimate with someone who is infected? If you can answer those questions, then you would know what to do with yourself.
Okay, so I asked this question because there are a lot of people that are actually out there that have no symptoms whatsoever, right? And they are not even aware that they have this infection. And so they keep on spreading the infection and transmitting the infection to other people. That was the reason why I brought this question. So
So
basically
I'm
just
going to I think as adults, this is some kind of education that we should all be having. As parents, we should be educating our children as well, so that when they become sexually active, they know look at your life is in your hands. I don't think
mm,
anybody is out there to stop you from doing what you have to do. I would only say that even the person who is meeting with this um, infected person going around and spreading the disease, you need to know the quality of people you hang out with. I know
mm,
somebody will say that, what if you don't know the person? If you doubt it, just when you doubt it, don't go there.
okay. All right, thank you, Dr. Jesse. The next question is, how soon after exposure can these tests detect infection accurately?
So if you wait at least 1 week, preferably 2 weeks after exposure, um, you would be able to detect it accurately. You,
Okay.
it's not acceptable to test too early because there's a potential for false negative results.
Mm,
So, like I said, timing is everything. Check your
mm,
timing before you go out there. Having money to test is not enough. Are you testing at the right time? Is one of the questions you should be asking yourself.
okay. Thank you, Dr. Jesse. With that, we've come to the end of the presentation segment. And before we move on, Dr. Jesse, you want to tell us about Lab2Doctors and why Lab2Doctors is unique and why people should use Lab2Doctors?
Yeah. With Lab2Doctors, we provide we provide services that surround the quality of your lab results. There's nothing as bad as having the wrong lab test, having the wrong treatment, your organs failing because you had the wrong treatment, wasting time and money to repeat a test over and over and not knowing why the results are wrong. We
Mm,
provide lab result troubleshooting. We prepare you before you even go to do the test. If you forgot to reach out to us and the results have come and you doubt it, reach out to Lab2Doctors. On the Lab2Doctors platform, which I'm going to be showing you shortly, we have a team of laboratory medicine professionals like myself who will contact you when you reach out to them. And they're going to answer your questions. This is not AI. I'm not talking
mm,
about AI. I'm talking about dealing with a real life scientist who is there to answer your questions. And we have fast turnaround times. When you reach out to us, if you want the results today, you will get it. Why? Because we live day in, day out with this information. So it's important that you talk to somebody who knows the research that was published last night, not AI that has not been updated last night. So the type of sample, when to collect it, if you want your clinician to reach out to us, I'm going to talk more when I show you the website.
okay. You want to show us that now?
Okay, yes. I'm going to stop sharing and take you to the website so you can have a better appreciation of what you would do when you visit us at Lab2Doctors. So let's see. I think it's here. Share. Let's see. Okay. No. Okay. Can you all see my screen? Are you seeing
Yeah, we
Lab2Doctors?
can see your screen.
Okay, so when you go to your search window and you put in lab2doctors.com, you're going to come to this window and watch my cursor here. I'm going to click schedule now. Schedule now. You could either schedule a doctor or a patient or a caregiver. Sometimes the patients are too sick and they need their family members or caregivers to reach out to us. I'll begin with the caregiver. If you're reaching out to us as a caregiver, when you click caregiver, this window pops up, and let me minimize this. There's something preventing me from clicking here. Okay, yes. When you reach out to us, when you click as a patient or a caregiver, it says patient consultation form. You're going to fill this form to reach out to us. Your name is A. Your last name is Y. Your email, for the purpose of this, I'll just put my email in there because that's your email, by the way. The date, this is your date of birth, 12/12/2012. And then your gender, select your gender, phone number. So, and when it comes to phone number, I know the services for Lab2Doctor are global, implying that we are not only serving the US. For the consulting part of it, it's global. We have people who reach out to us all over the world. It's for that reason that we have every country on earth right here. You just need to go there and select where you're reaching out to us from and put in your phone number so someone will reach out to you. And then you come here and I say purpose of inquiry. This is when you can tell us everything you want us to know. Why are you reaching out to us? And I'm just going to say demo, and I will say submit. It has sent out a notification to the team. The first person who picks it up will reach out to you. I'm just going to go back. It redirects you to the website. So I'll go back into the website. For some reason, okay, it's in here. I'm going to come back and go as a clinician. So if you come to us and you are a doctor, you want to, you need some services. So anyway, this is my clinician profile. Normally, if you're not a clinician, I'm going to log out and then I would show you what would happen. Because I already have a clinician profile, it took me in. But what if you are not a clinician? So let me go home and see if I can show you that screen. So doctors. So when I say doctors, these are caregivers, whether you're a nurse practitioner, RN, any physician assistant, you are a caregiver. You would come here and enter. This is the form you fill. You need to sign up first to be able to receive our services. So and you do this just once. Once you've signed up the first time, subsequently, when you come to the site, all you need to do is to log in, like you see me logging in right now. So I am going to log in because I have a profile as a clinician. And it brings me to this profile. So this is your dashboard. This is what you see as a clinician. It says troubleshooting requests. I know troubleshooting sometimes looks like troubleshooting the internet, or what are we troubleshooting? No, we are troubleshooting your results, your lab results. Do they look suspicious? Do you doubt them? We are going to troubleshoot them for you. That's why we are using this term here. So when you come to troubleshooting requests, you click, if that is why you're here, then you say add new. You're going to fill this form. Since this is my form, some of the things I've already used it, so some of the things are already populated. I'm going to try to take you through so that you see what I would normally see. This is 12, whatever the time is. Let's see, what's the time? 12:55. All right, I'm going to select 12:55, and then that is not, this is not, okay, so communicate me by email, designated office if needed, and then patient's name. For the purpose of this, again, I'm just going to put, and in essence of time, I'm just going to put something that would enable me pass through this. Patient's age. BMI, I'm just going to put random things. Your race, I'm just going to say white because that was the first thing on my screen. The sex is a female, and then I would say next. It's going to take me to the next screen where you enter your patient's information. As a clinician, you reach out to us for your patient. You're not reaching out to us for yourself. If you're a clinician and you're a patient, you reach out as a patient. So yeah, it says you tell us the current prescription medications, you tell us the over-the-counter medications, you tell us the current supplements that your patient is taking, tell us any recreational drugs that your patient is taking, cocaine, marijuana. If you know it, you tell us. When you answer all of these questions, you're going to say add test. I want to investigate, for example, I'm interested in A1C for my diabetic patients. I said that I ordered a serum sample. I ordered the test yesterday. And there's a question here about, let me see what this is. Sorry, there's something on my screen. Okay. It says that, was this supposed to be a fasting sample? You say yes or no. And you have to answer all of this. The sample test, the date the sample was tested, the date you received the lab results, the results of the specific lab test, the reference range that was given at that lab, because reference ranges sometimes depend on the lab you're using because of location. Also, were you expecting the results to be low? Were you expecting the results to be high? What is your problem? And then you submit. When you submit this, I'm unable to submit because I'm just faking it now. When you submit this, again, this query is going to come to us. You may want to, I will say yes, continue, delete. You may want to request for phlebotomy services. When it comes to phlebotomy services, this is only within the US. Troubleshooting is global. Phlebotomy services within the US. So you come and say add new, and then you tell us the type of patient. Is he an adult or a pediatric patient? You tell us the type of patient. You tell us the date when you want us to send a phlebotomist to you. Why is it important that we send a phlebotomist to you? Because we have phlebotomists whom we have trained to know exactly what they should be looking for. What we have trained them is not what is taught in phlebotomy school. So I call my phlebotomists super phlebotomists, because they know what will not be normally taught in a phlebotomy school. These are people who have shown interest in making sure that they are not only collecting blood samples, but they are accurately collecting samples that will give good results. So, and then when you enter, let's say you say my patient is pediatric, what is the number of patients? Sometimes they want us to come to their clinics. It's a busy clinic day, and they're expecting so many patients. We've already put the cost of blood draw per patient. If you say you're going to need service for 10 patients, you put it in there for us. Tell us anything you need us to know. Say, check in at the front desk. We have a little dog in the office. Tell somebody you're coming. Tell us before you arrive. Whatever it is, give us some little communication. You drop a little note, and then you click submit. Of course, there's nothing to submit, so I've canceled it. The last but not the least is recurring lab orders. As a clinician, you may be taking care of diabetic and hypertensive patients, even cancer patients. These diseases are called diseases that you live your life with. So they are diseases that are managed with medicine and lifestyle. So if you have one of those patients, like, for example, diabetic patients need to do an A1C test every 3 months. If you have one of those patients, you can let us know in advance. Fill this form, tell us the test, tell us how often you need us to do it, and when you need us to stop it. When it gets to time, the calendar would remind us and would reach out to the patients. It makes it easy to prepare for the doctor appointment even before the appointment. So that's what we take up that task from you, and we make it our responsibility. So those are the things that we will do for you if you go to the Lab2Doctors website. While we are on it, there's a link that was posted. Please, if you don't mind it, go to the chat window, click that link, and register on that link. Register so that whenever you need us, we are not going there as a sick person trying to register. Register today so that you can receive information from Lab2Doctors.
All right. Thank you so much, Dr. Chelsea. Our time is fast spent, but I know that a lot of questions have not been answered completely. So if you have questions, you know where to find Lab2Doctors. You have to visit the link on the website. The link is in the chat box, www.lab2doctors.com. And you can also follow Lab2Doctors on all social media accounts. We are on Instagram, on LinkedIn, at Lab2Doctors. So for any questions you have whatsoever, Lab2Doctors is here to guide you and be there for you every step of the way. So before we sign off today, I would like to just bring us back to the most important lesson that we've learned from this session. Sexually transmitted diseases test results, they provide more information, and they're not based on conclusions. They cannot tell us when an infection occurred, or who this infection came from, or what it means about someone's character, choices, relationships, and whatnot. So we have to be sure that you are mixing with the right people, like Dr. Chessie said, and you ensure that you are getting tested. So thank you so much for such an inspiring session, Dr. Chessie. It's been such a pleasure being with you. And thank you to everyone joining us for this session. Keep staying informed, keep making informed decisions, and follow up for every single question you have. Remember that the answer is never to assume, right? So you have Lab2Doctors there to guide you on every step of the way. So thank you so much for joining our session today. And on behalf of Lab2Doctors, we say thank you. Have a beautiful day, and thank you so much for joining us. Dr. Chessie, do you have anything to add?
Well, I just want to appreciate the guests who joined us today for this session. I know you would have been elsewhere, but you decided to take your lunch break or whatever time it is for you to join us. This means a lot to us because as laboratorians, we are the least seen people in lab medicine, in medicine in general, because we are always busy running tests in the lab. But I am here to tell you that Lab2Doctors has those laboratorians who do not only want to be staying in a lab. We want to come out and meet the patients where they are. So if you have any burning questions, do not go to Google. Do you know when Google was last updated? Do not go to up to date. Do you know when it was? It says up to date, but it's not updated. I can tell you that because I use it. Don't go to whatever doctors.com, whatever. There are different sites. The best thing to do, don't even go to AI. Come to Lab2Doctors, and we'll tell you what is the most current thing and leave you with the reassurance of having the right results at the right time. Thank you.
Okay, thank you, Dr. Chessie, and thank you everyone for joining us. We've come to the end of the session. Have a beautiful day ahead, and bye. Thank you so much. Bye, everyone.
Bye.